This is my first video response to RealSelf questions. I think it's a lot easier to be able to respond to a question using a video. The question is, can you have an eyebrow transplant and a hairline transplant at the same time for traction alopecia or hair loss there? Yes, in fact, I performed quite a few of those, and it's most commonly apparent in African Americans or people of African descent because of the desire to pull the hair back. And one word of warning: when you're doing eyebrow transplants, you have to find someone that's extremely skilled to perform an eyebrow transplant, because it requires quite a bit of art and mastery. It's the hardest thing that you do. In fact, I'm giving a lecture next week at my course on hair transplant about eyebrows. And one of the things, though, is very, very important. It's probably the most important part of this answer, is that you have to make sure that you don't have frontal fibrosing alopecia, alopecia areata, or other things going on. What are all these terms? There are types of scarring hair losses that will prevent you from having a successful outcome. And a lot of times when you're having a loss in the eyebrows and the hairline, you think that this is actually just a normal hair loss, when actually it is absolutely not. And the frontal fibrosing alopecia is the most common type. It affects all types of ethnicities and genders, and there is really no clear idea of how this is caused or what's happening. But frontal fibrosing alopecia is a type of hair loss where you have progressive hair loss, usually in the lateral temple, involve the whole eyebrow itself, going up into the temple hairline and involving sometimes the entire hairline. Things that you can look for are you can have skin changes, you can have papules or changes to the skin quality. It looks flatter. There can be more telangiectasias, which are blood vessels. This type of hair loss is a scarring hair loss, which is, again, a dermatologic condition that cannot be treated with hair surgery and can be determined if there's a high clinical suspicion with a biopsy by a dermatologist, and it has to be performed in a way that doesn't leave scarring. So you want to avoid areas that are very exposed, but the temple is an area that's really, really good. Also in areas of active disease, and you usually need about 2 biopsy samples so you can get a horizontal and vertical sectioning. I'm not a dermatologist, I'm a surgeon. I don't want to get too much involved with this, but the bottom line is, when I see someone with eyebrow and hair loss of the hairline, I have a very high clinical suspicion there can be frontal fibrosing alopecia. In fact, I just saw an African American patient that really, to me, needs a biopsy. If anything, even if she has a biopsy, my clinical suspicion is so high of the FFA that I wouldn't even do it. But if you look at my website, you'll see a lot of photos and videos of these combinations, particularly in African American patients. So FFA is important. Something that's going to be less common is going to be a alopecia areata, a totalis, where they're getting eyebrow loss. And the reason why it usually is so obvious is that when their eyebrows are gone, their whole hair is gone on top of the scalp, so there's not going to even be any question of that condition. So the biggest one that's going to masquerade is FFA. So before you have this done, before you don't get a qualified surgeon to do it, but you also want to make sure that you look for these conditions that would make your hair surgery unsuccessful. Thank you.